Well, thank you for having us here. I'm new to actually Marietta. The two founders of GattaCo Technology are here with me, but I'm representing the company and wanted to also acknowledge that we have really been taken over the Marietta Innovation Center slowly and growing. So it's been a great experience to have that space for a startup company to really nurture and grow. So thank you. I was going to start off by saying we can all feel, it's not happened yet, but we can feel it, that healthcare is slowly moving closer to the home. We're seeing it with all of us maybe either doing it or knowing someone who's done a telemedicine virtual call. We have seen it with COVID at-home testing that all of us have probably done by now. And really this market is taken off for multiple reasons, partly because of the pandemic. And that's the silver lining, maybe we can say, is we all wanted something like this to happen. And you can see that an example of the telemedicine market, 90 billion, and projected to grow really fast. The challenge is we're still only talking about COVID testing, maybe some flu testing with swabs, but really 70% of medical testing is blood-based. And we all know it because we all go to the doctor's office, get blood drawn, sometimes once a month, sometimes twice a month, depending on if you have some pre-medical condition. So all of this today is being done with blood, but blood testing is complex, which is why it is mostly done in labs. And it's complex for multiple reasons, but one of the biggest is that blood is not actually the sample they test. They separate the liquid part of the blood from the cells, which is called plasma. And that plasma is what goes into all the FDA-cleared tests that we all use or our doctors prescribe. That's why blood testing has only been possible in labs so far, even though swabs we can do ourselves. So really, what GattaCo has done, and I've been in this space for quite some time, which is what attracted me to them, is it's the first and only conversion of that blood into plasma at home, which makes it a sample that's ready to test. You can do it at home pretty easily. It's passive, so there's no battery power, no electricity, no fancy gadget to use. It's a very simple capillary action, and either you can test at home in the future, or today you can just mail that sample in, just like we all learn how to mail samples in with PCR, and you can do blood testing without leaving your home. So there's a little picture of the product there, but the next slide, will go down a little fast, is a little video of how easy it is. You literally finger stick, which we know for glucose testing people can do, and you touch it to the device. And the device does the rest by itself. It'll take that blood, as you can see with the animation, plasma comes out, and somebody just dispenses that liquid plasma into a little vial and you can ship it. And again, in future renditions, you can also test it right at home. So GattaCo's working both. So no equipment, simplicity, thank you, just stay there, as well as a lot of different IP that came together. This has never been done before. It sounds simple now because those two geniuses over there figured out how to do it. But it's been very cute technology, and I'm here to basically figure out how to commercialize this, and that's what we're working on. So if you go to the next slide, this is where we're talking about markets. What could you do with this? Well, we all know about the COVID antibodies. Actually, most of our team informally knows what our vaccination levels are as they go up or down with booster shots as the time goes by. So a lot of antibody testing. My own daughter has been diagnosed with celiac, and she has to go in every 2 weeks to detect antibodies to gluten. A 12-year-old doesn't like to get her blood drawn every 2 weeks, and we don't need it. Most of that blood goes to waste. A little drop of blood can go a long way, and which is where all these different types of, in the previous talk we were talking about chronic fatigue syndrome, same thing, there are antibodies that you're testing that can be done easily and simply and cheaply, hopefully. Same thing with certain infectious diseases, autoimmune diseases, as well as, of course, allergy type testing. So a bunch of different areas that we're looking at. We are working with some major collaborators to move forward in certain areas. We're not going to conquer the world, but we're going to showcase this in a few different areas. And we have some good investors now. We have collaboration with hospitals like Cedars-Sinai up in LA that are providing data to validate this technology. So if we go to the next slide, this is where we are as a company. We raised some money as I came in. We started our product development efforts. This year, our big focus, we already have a couple of commercial deals with some big partners. So actually, the #1 player in COVID antibody testing is our customer. So we're scaling up manufacturing as well as validation testing. We're going to be launching the first generation product at a national conference in Chicago. So really taking it out there and letting the market basically kind of test it in a research setting initially, but of course then slowly going towards the clinical side. And then we need to raise more money just to commercialize. So that cycle will repeat. But in terms of the first proof point, I think the technology has been converted into a product that we think we can start marketing. And rest, we'll see how it evolves. So thanks for having us here.